You pay your bills electronically. You listen to your music electronically. You get your news electronically. So why do you have to carry your paper medical records from your doctor to your specialist, to the hospital, and finally back to your doctor again? Now you don't. Your doctors can get your medical information quickly, safely, and confidentially with Connect Virginia, the statewide health information exchange.
You have no idea how many times I've said the same story about my accident over and over again to different physicians.
I really couldn't count how many healthcare providers we've seen. There's been so many. My big pile of records right here is how I'm sharing medical information with all the providers we see.
As an internal medicine doc in a hospital, I need to be able to get information as timely as possible. If I can't get that information, it leads to unnecessary repeating of tests or potentially delay of care.
The old way I used to get information about patients was either faxing and waiting or a phone call to doctors, but not getting an answer, particularly on weekends, and that covering doctor may not have the accurate information. And with Connect Virginia, I get instant access to information, and that's extremely helpful.
So what is Health Information Exchange? Health Information Exchange allows doctors, nurses, pharmacists, and other healthcare providers to appropriately access and securely share a patient's vital medical information electronically.
What excites me the most about Connect Virginia is the ability to have immediate access to patient records for the physicians and the hospitals that will be taking care of the patients.
On a regular basis, there's usually probably 2 to 3 doctor's visits a month that we're going to. Connect Virginia could take away a lot of my worries. It would lift a very big burden off my shoulders and help me focus on my son and give my son 100% of my love and attention.
Health Information Exchange would make me feel better about my condition. It would give me an additional sense of security. It would assist me quite a bit in just getting doctors up to speed about my condition if I'm going to see somebody new.
The Health Information Exchange allows you to provide effective and efficient health care by allowing you to access the patient's clinical data electronically in a rapid manner. This allows you to gain access to their most significant laboratory, X-ray, and clinical data, and allows you to act on that as soon as the patient arrives rather than to postpone treatment while waiting on obtaining additional clinical information.
A lot of times patients' care is very fragmented. People work as consultants in this area. They are tourists, they are family members, and when they become sick and have to go to the hospital, their information isn't necessarily at the institution that they're presenting to. So you need an accurate, secure way of getting their information to treat them appropriately. The security of patients' health information is extremely important. Their health information is theirs, and they should feel comfortable that it stays secure. And Health Information Exchange is the tool to do that.
As a physician, a patient's privacy is foremost of importance, and making sure that only parties that are authorized to view information have access to patient data.
The systems that are being developed for HIEs are very secure. They're encrypted. There are many safeguards involved in those to prevent inadvertent disclosure of that information to sources that they're not supposed to go to.
Your medical information belongs to you. Connect Virginia provides a service that facilitates the sharing of vital health information to speed treatment, reduce duplicate tests and procedures, and could potentially save your life. However, you always have a choice. If you don't want your information to be shared by Connect Virginia, go to connectvirginia.org and complete an opt-out form.
The benefits long-term is that we can look at the population and the disease burden. We'll be able to access the patient registries that will actually be able to have us monitor and track how well we're doing. We could actually have public health policy to identify patients at risk and to get them connected to the right treatment as early as possible, and hence improve their quality of life and have better healthcare outcomes.
Join the journey with Connect Virginia. Visit connectvirginia.org.